What is the latest and greatest IV or supplement or whatever? And we forget about the causes.
Hey everyone, welcome to the Evolving Ageless podcast, the antidote to aging for the enlightened woman. I'm your host, Michelle Dreilich, and I am on a mission to change the way women age. I hit 50 and realized I was at the top of the hill, right? And I wasn't going to go down without a fight. I wanted to make sure that I'm doing everything I can to affect the way that I age. Because really, if you think about it, getting older is a function of time. The clock passes. However, aging is a function of how I live. And so I'm inviting you into this tribe so that we can learn all of the latest and greatest research on aging. And I'm joined today by Dr. Evan Hirsch. Dr. Hirsch, welcome. It's so good to have you here.
Thanks so much for having me on, Michelle. I'm excited.
That's great. And so Dr. Hirsch is an optimal energy doctor. We're going to talk a lot about fatigue today, which I know when someone rounds the corner of 50, that really sometimes creates the perfect storm for fatigue to start to set in. And we're going to talk about that. Dr. Hirsch is a best-selling author of the book, Fix Your Fatigue. It's a 4-step process to resolving fatigue, achieving abundant energy, and reclaiming your life. That's the title of the book. So that's a tall order. So I'm excited to kind of get in. He's the world's only fatigue expert, and focuses, like we talk about all the time, focuses on the root causes of fatigue. So let's dive in and get started. So welcome, Dr. Hirsch. I know that this came about for you from a personal experience. So I thought maybe you could share a little bit about how you resolved your own chronic fatigue.
Absolutely. And it all really started when I entered residency. And I met my wife. I had moved from the East Coast out to the Pacific Northwest, met my wife, fell in love. And 3 months into our relationship, she couldn't get out of bed. And so she started with chronic fatigue, and I'm in my residency program, and I'm doing my best to try to stay awake for 80, 100 hours a week and try to support her. And there really wasn't much available. I was asking all of the allopathic doctors that I knew, those are the MDs and the DOs, doing research, and this is back in mid 2000s. And so there wasn't a lot of information out there. It's like 2004, 2005. And so I went on this quest, and unfortunately it took her 3 years to get out of her fatigue, and I felt completely powerless. Here's this woman that I love, and so I started on that mission, and it's just so fortuitous the way that things happen, because I started a functional medicine practice. I saw a lot of people with fatigue, started helping them, and then I got fatigue, and my fatigue lasted for 5 years. And it was near impossible for me to see patients. My brain fog was so bad, I could only function for a couple hours a day. Then I would come home, and we had a new baby. I could barely help out at home, couldn't support with the baby, couldn't chase the kid around. She's like, "Daddy, play with me." I'm like, "I can't, I have to rest." So it was really awful. And so I finally started taking my own medicine through this process, and started going to every single course that I possibly could and learning about all the potential causes, because I knew that if I found all of the causes, there's no way that I couldn't succeed. And it turns out that I had pretty much every single cause that we're going to talk about today, which is why it took me so long to get better. But it was really about that process of finding all the causes, and then with laser-like efficiency, going after each one of those. And I just kept improving my energy until I've got the 8, 9, 10 out of 10 energy that I have today, and I'm able to do everything that I want to do in life.
Wow, that is an incredible story, actually. And it's not uncommon. I think that's why I was so excited that you were able to join us, because I know, having been in clinical practice, fatigue is one of those things where especially in women, we take care of everyone before we take care of ourselves. And so we start to think, oh, this is just a function of not sleeping enough, or this is just the stress that I'm under. But there's a real kind of criteria that you go through, right, to determine if we're talking about run of the mill, not sleeping enough fatigue, and actual true chronic type fatigue, right?
Right. Yeah, so there really is a gamut here. You could just be tired all the time, and you can also have chronic fatigue syndrome, which has a lot more strict criteria associated with it. But what I tell people is if you're getting 7 to 9 hours of sleep a night and you're still tired during the day, or you're requiring stimulants or caffeine or energy drinks or whatever it is to get you through the day, then you've got a problem. Your body is crying out for help. Your body is telling you that there's an issue here. Or if you're requiring more than 7 to 9 hours of sleep a night and you feel like you could sleep all day, like there's a problem and you need to address it. And so my program works whether somebody's just has fatigue, and chronic fatigue just means that you've got fatigue that's lasting for a long period of time. So yes, if you are a teenager or you're in college and you had finals week and you stayed up and you burned the candle and then you have to sleep for a month afterwards, but then you recover, like that's okay. Like your body's able to recover. But if after that period of time you have not recovered, or you hit menopause and then all of a sudden your energy goes down the toilet, there's something, your body is yelling at you. You got to pay attention. You got to start looking at all of the causes that might be pertaining to your fatigue.
So that's a great point. All of the causes, right? So what are some of the causes of fatigue? Because again, when we talk about functional medicine and we talk about applying functional principles, which is kind of like looking at the root cause, there's very often never just one single root cause of something, right? And we kind of in conventional medicine, we think of it as, here's a problem, here's a solution. But in functional medicine, things compound, right? And lead to that larger issue. So I would love for you to share what some of the causes of fatigue are that we can kind of check off on a list to see how many of those are compounding for us.
Absolutely. And you're absolutely right. There are, everybody who has fatigue has multiple causes, and everybody has different multiple causes, which is why it makes it so challenging to treat. Where somebody might take B12 and all of a sudden they feel so much better, and you take B12 and it doesn't make a difference for you.
So right, because we have different root causes. That's exactly right.
Exactly, yeah. And so what I found is that there's 10 categories of causes, and we're going to kind of dive into these a little bit more, but we can really break them apart into deficiencies and toxicities. And so the deficiencies are things that are not in your body that are supposed to be in your body, and toxicities are things that are in your body that aren't supposed to be there. So when we look at the deficiencies, we're looking at things like hormones. So adrenal hormones, which is a little triangular gland, sits on top of the kidneys and produces cortisol as well as the sex hormones, especially when the ovaries and the testicles get quiescent. So as people hit menopause and andropause for men and their hormones start going down, then the adrenal gland starts picking up the pieces. It starts producing sex hormones. It also is responsible for our stress response. So very important hormone that goes down the tubes over time. Thyroid, the sex hormones, like I mentioned, estrogen, progesterone, testosterone. So those are hormones that get deficient. Then there's deficiencies in nutrients. So we're talking about vitamins, like vitamin B12 is a big one, vitamin D, minerals like magnesium, iron, those can play big roles. There's something called mitochondria, which is the energy center of every cell in the body that produces about 70% of our energy. And it gets squashed by all the toxicities. And so consequently, then if you have these toxicities, your mitochondria is going to be dysfunctional and deficient. And then there's all the lifestyle habits that I know you're very well versed in, better than I am, no doubt, where you're talking about deficiencies in habits that people have. If you're not getting enough sleep, if you're not getting 7 to 9 hours of sleep a night and figuring out exactly how much you need, if you're not eating enough good food, so if you're eating a lot of grains, if you're eating gluten, if you're eating food that's not organic, If you're not drinking enough water that's filtered, enough good water throughout the day, if you're not getting enough movement, doesn't have to be exercise, just has to be good movement. So those are all the lifestyle habits that people tend to be deficient in. So those are the deficiencies. And then the toxicities, we're looking at things like heavy metals, talking about things like mercury. Over 100,000 pounds of mercury are being dumped into our oceans every single year, which comes out in all of the seafood that we consume. We're talking about chemicals, over 84,000 chemicals we're exposed to on a regular basis, everything from cosmetics to plastics to herbicides and pesticides. We're talking about molds. Over half of the buildings in the United States have water damage, and most of those have mold or other organisms growing that can be a problem for folks. And then we're talking about infections. Often this can be Lyme type infections, the Lyme co-infections like Bartonella, Babesia, Borrelia, Epstein-Barr virus, a number of those. And then emotional issues. So if we've got some negative patterns on how we relate to the world, if we've been taking care of everybody else and we haven't learned how to take care of ourselves, we actually feel like it's being selfish when we take care of ourselves. That's a big problem. When we need to change these patterns, we need to change our mindset. We need to do work on those things. So those are the toxicities and the deficiencies. Hopefully that wasn't too overwhelming, but those are the broad strokes of all the things that could be going wrong when someone is very tired.
No, I think that's a great overview because, again, very often we're led to believe it's one or two things like sleep or stress. And while they play an important part, we're not really talking about mitochondria or things like that. The other interesting thing that you mentioned is hormones, including thyroid, right? Because thyroid gland produces hormones. What I find interesting related to hormones, heavy metal testing, even testing for some of these insidious infections like Lyme or mold, is that not every practitioner is testing the right way, right? So for thyroid, for instance, I can't tell you how many women I've seen over the years where their doctor just ran a TSH, a simple thyroid test, and that doesn't even come close to telling the story of what's going on with your thyroid gland and how it's actually functioning within your whole system. And I know mitochondria-wise, living with chronic conditions, things like diabetes or insulin resistance or obesity, things like that actually squash your mitochondria too. And so it's good to know, I think, for me, it's information is power. And once you know something, you can't unknow it, right? And so being able to ask questions about what are the right kinds of tests that should be done to understand where it's coming from. I know, for instance, Lyme, so many patients say, oh, I was tested for Lyme and I was negative. And then once a more thorough test is done, we can see the kind of subclinical or other signs that there might be Lyme at play, right? So do you see that in clinical practice too?
Absolutely. And so interestingly enough, 75% of all of the causes that I talk about can be diagnosed clinically, so based off of your symptoms. And so it's very important to remember that, yes, we want to gather all the potential data that we have, but all of our labs are imperfect. We always want to combine the subjective experience, so our symptoms, with these labs, and the labs are more confirmatory than they are diagnostic.
Sure, because they're just a snapshot in time, right? It's just at that moment. That's great. So let me tell us why it's so hard then to treat fatigue, because first of all, understanding what all of these areas could be it's like 90% of getting there, right? Is acknowledging what could be the source. But why is it so hard to treat?
So it's really about how disparate the causes are for the individual. And so when somebody, because it's so easy to say, hey, I heard that you were tired and you took something, what did you take? Maybe I should take that too. And we get so focused on the treatment. What is the latest and greatest IV or supplement or whatever? And we forget about the causes. we forget about going after, do I have this deficiency? Do I have this toxicity? Because once you find that, then you can actually take the product, the supplement, whatever it is, that's going to target that thing specifically, that is going to end up removing that cause and making you feel a ton better. So that's the first thing. The other thing is that when people come to see me or they have fatigue, I tell them that, you have 16 nails in the bottom of your foot. And there might be the gluten nail in there where gluten is causing you to be tired, and you've got the mold nail, and you've got the lime nail, or whatever it is. But usually it takes a mass effect where you have to get a number of the nails out in order for you to start to feel better, in order for you to make huge jumps. Because usually you pull one out and you may experience like a small improvement. So I always ask people, what's your energy on a scale from 1 to 10, 10 being ideal energy? If you're at like a 2 out of 10 or a 3 out of 10, and you pull out the gluten nail and you have a whole bunch other nails that are in there, you may not notice a difference, but you still need to have that gluten out of your body and out of your life. So it's hard sometimes to get that recruitment from the individual, from the client, for them to understand, yes, I understand that you're not noticing a difference off of gluten, but you still have to be off of it right now. And I understand that you may not notice that we fixed this cause, but you may not notice anything yet. But that's because it's this whole picture. Like, you have to remove 10 out of those 16 nails in order to see this huge, significant jump. While you're getting there, you will get these small improvements, which always feels good and always helps. But it's having that trust and understanding how complex the process can be. And that usually when I tell people, or they say, why do I still have fatigue? I've been working on this for years. It's either they haven't found the right causes, or they haven't found the right treatments. Because I tell you, 100% of the time, if you know what all of your causes are and you're taking the right treatments for those causes, you're going to get better. There's no doubt about it, because you're focused on exactly what is happening.
That's perfect. And I've always equated it to like a threshold. Any of these conditions that numerous root causes are at play, sometimes you've got to get below the threshold and you need to take multiple things away or improve multiple things at once, so that you can lower that threshold of having a reaction. And on a quick side note, and I'm sure my husband will love me sharing this, but we are largely a gluten-free family. And on occasion, he'll have, pizza or a pasta that's not gluten-free. And I know immediately, because his sleeping patterns change, his snoring gets so loud. We have these like battles in the bed at night when he's eating gluten, because in larger quantities, because it absolutely interferes with his sleep. It's so obvious to me now, and we've had this conversation. So I'm a huge proponent of being gluten-free, so for so many reasons, but I can attest personally that it absolutely impacts your ability to rest and your inflammation level. So that's amazing information.
Yeah, and I think
All
you,
right.
you make a very good point around the mass effect too, where it's basically a whole bunch of crap that's in the body that's not supposed to be there. And so you have to take these layers off one at a time. There is no magic pill.
No.
Sorry, folks. I'm here to tell you,
I
unfortunately, there is
know.
no magic
I
pill.
know. And the trick is, I feel like when we mask it, whether it's with supplements or we mask it with, Red Bull or caffeine, it's actually making it worse, because those products, those things tap into your adrenals and they make your adrenals work even harder. So even though you get that short-term bang, like you can get through the day, you're actually causing more harm in the long run. So it's so important to just take a step back. And I think the most empowering information is that you can do it. It can be done. It's what you focus on. You do it every day. So you've got this 4-step process that's in the title of the book, right? The 4-step process to resolving fatigue, achieving abundant energy, and reclaiming your life. So if you can share them with us, what are the 4 steps? What does that process look like?
Absolutely. So the first step, you can probably guess, is to assess all of the causes, right? I'm all about the causes. If you don't know your causes, you can't map where you're supposed to go, right? And so you have to assess all of the causes for all the deficiencies and all the toxicities. Then you move into step 2, which is to replace the deficiencies. So the fastest way to feel better and to get where you want to go is to replace your adrenals, your thyroid, your sex hormones, your mitochondria, your lifestyle habits. So you fix those things, and it makes a significant difference in people's lives. And this is what most naturopaths, functional medicine docs, a lot of docs who are generalists are usually doing. And that helps people get better to a certain point, you know. But then if you want to get the rest of the way better, then you want to make sure that you're removing those things that are causing those deficiencies, because it's actually step 4, which is removing the toxicities, actually causes all of those deficiencies.
Right,
Okay?
that's right. Yep.
So we are replacing, and these are Band-Aids, even though they are more natural Band-Aids, because we're not harming the body with caffeine that's whipping the adrenal gland like you talked about. But so that's step 2. So step 1, assess the causes. Step 2, replace the deficiencies. Step 3 is opening up the detoxification pathways. So this means open up the intestines, open up the liver and kidney, open up the lymph, open up the brain lymph, so the lymph that's in the brain, or the lymphatic system. And so I see the body as kind of a series of tubes where you want to make sure that everything is flowing out. You know, you've got this garbage system called the lymph, but it's very easy for it to get congested, especially when we all have all of these toxicities. So very important to open these up.
What's interesting is I feel like sometimes people get a little freaked out by the word toxicity, like it's a woo kind of word. And I think as a society, we toss the word detox around a little too much. But in the case of what you're talking about specifically, I think it's really important to know. I mean, most people don't realize that waste and having regular bowel movements is a part of our detoxification pathway. It's how we get rid of garbage. If you've ever experienced constipation for 2 or 3 days or more, you know you start to feel bad. You feel lethargic, you feel headachy, you feel feverish. It's all because how would your house look if the trash man didn't come for 3 weeks, right? It would, your house would stink. And so I think because we use this word detox so much in society, but from a clinical perspective, Dr. Hirsch, that this is a true thing. This is a pathway that needs to be addressed. And we talk about our liver, and we talk about liver detoxification. It's one of the primary roles of the liver, right? The liver has 8 key jobs, and one big one is to get rid of toxins. And if you wonder what that really means, if you've ever had a cup of coffee or you've ever had a glass of alcohol, you understand what detoxification is, because the minute you start to feel a little buzz from your caffeine or a little buzz from your alcohol, and then it's gone, that's because your liver neutralized all of those toxins in your body. So I just want to demystify that for people, because I know sometimes we in the functional world use the word detox a lot because we understand the pathway. And I want to make sure people understand it's not this woo kind of thing. It's really very physical and functional in your body. It's a great point.
Thank you so much for saying that, because that is very important. And, you know, I'm an MD, I went to conventional medical school, and we learned about phase 1 and phase 2 detoxification in the liver. I mean, it is in our textbooks.
It's biochemistry, right? Absolutely.
But it has gotten this sort of woo picture. So it is important to bring that back, that these are normal pathways. Like, we have to be able to get the toxins out. And so you poop them out, you pee them out, you sweat them out, or you breathe them out. Those are actually,
I love it,
the ways that we get rid of toxins. And so you have to make sure those pathways are open. And like, part of my story was that I didn't realize that it wasn't normal to poop once a week. And so my entire life growing up until I was in my 20s, and I realized that I had a dairy allergy, I pooped once a week. And that's a huge contributor to my fatigue, because if you're not pooping at least once a day, ideally twice a day, then you're just reabsorbing all of those toxins that you're trying to get out of your body.
And for women, estrogen is one of those things. remove estrogen from our body when our body's done using it through our waste system, through our bowel movements, and through pooping. And so if you're constipated, your body's actually redepositing, reabsorbing that estrogen back into your body. And when your body's done with it, it's done with it. It wants it out.
Right.
And so it's an excellent, excellent point. So, okay, so this is great. So we've talked about the 4-step process.
Well, we did 3.
We did 3. What, the 4th? Right, we got to toxins. Sorry, I
Right.
derailed us on toxins.
No worries. It was great. So we assess the causes in step 1. We replace deficiencies in step 2. We open up the detoxification pathways or the drainage pathways in step 3 so that we can get into step 4, because it really is all about step 4. And that's the toxicities. And that's the real reason why we're so sick today, unfortunately, is because of the heavy metals, the chemicals, the molds, the infections that lead to allergies, the negative emotions. So all of those things are contributing to all of these deficiencies and all of these other problems, and they just build up over time. And so it's very important to kind of go after these, and they all contribute to each other. You know, there's infections that are feeding off of heavy metals. There are heavy metals that are contained in the biofilm, so basically in the hiding places in the body for infections to hide. And so you start removing some of those heavy metals, and then all of a sudden the infections come out. There are, you know, you can't get rid of infections if you have heavy metals, chemicals, and molds, because heavy metals, chemicals, and molds will take your immune system, hijack it off into left field and occupy it over here, and the infections will have a party, and you can't get rid of those infections unless you've got a somewhat intact immune system.
Right.
So that's the.
And if you've been living in that environment, meaning whatever is going, you know, your current lifestyle, your current diet, your current chronic conditions, the longer you live in that, the more things can hide, right? And cause issue.
Absolutely.
Because they're hiding. Just if always going back to that idea that inflammation kicks off a whole huge process. And when you live like that, I feel like the immune system, well, I know the immune system is compromised. It's not able to function the way it's meant to function. And so that's why, and things like mold are really, it's insidious. It's everywhere. And I live in Florida, so we're kind of really on top of it in our home, because moisture can lead to some real reactions for people. It's
Absolutely.
Great. Good information. So we talked about that. You mentioned infection. I want to get a little more specific, right? Because I know one of those types of infection can be something like Lyme. If you want to talk a little bit about, or I know it's not the only one, so maybe these other chronic infections you're talking about, we can go a little bit deeper on that for a minute.
Yes, I would love to. So what's really important about Lyme and its co-infections is this idea that it is actually a clinical diagnosis. So we talked about how 75% of these causes can be assessed by your symptoms, and even the Centers for Disease Control, the CDC in Atlanta, talks about how Lyme and its co-infections are a clinical diagnosis, and that the Western blot test is for epidemiologic studies. So it's not for diagnosis.
It's for clinical research. That's right. Just to be clear.
Exactly.
That's right.
So I'm going to tell you right now.
But somehow practitioners, physicians have learned, I just do this Western blot. This is how I diagnose Lyme, because that's what I've read in the literature, right?
Well, for years and years and years, there wasn't another option. Now there's a better urine PCR test called DNA Connections that anybody can get at DNAconnections.com. That's with an X, CONNEXINOS.com.
We'll include that in the show notes. That's great.
But it's still a clinical diagnosis, and that test is $650. So not everybody can get that test.
Wow.
And you can get it without a doctor's order too. So, but yes. So, and what's really exciting is that I'm going to tell you the symptoms right now of these Lyme type co-infections, so you can tell based off of your symptoms whether or not you have this particular infection. So the first one is Borrelia, which is otherwise known as Lyme. And in order to have Borrelia, you have to have the following symptoms. So you have to have symptoms that come and go. So days that are better than other days, oftentimes you cannot schedule things in your calendar because you're not sure whether or not that's going to be a good day or not when all of your symptoms flare. So that's one of the symptoms you have to have in order to have Borrelia. The other thing is you have to have symptoms that move around the body, either joint pain, muscle pain, or nerve pain that moves around the body. And that could be, you wake up in the morning and you've got joint pain in the shoulder, and then a couple of hours later you've got joint pain in the knee. Or it might be that you've got pain here, and then several days or several weeks later you get pain in a different joint. Same thing with nerve pain, same thing with muscle pain, where it has to move around the body. So if you don't have those symptoms, you don't have Borrelia, which means you don't have Lyme.
Wow. And you just saved somebody $650. I mean, obviously, if you have these symptoms, you want to confirm it, but those are pretty definitive. It's not like the typical headache or nausea, which could be anything, right? They're pretty specific, that they move around and that they're not always predictable. They come and go. Yeah, that's great. Wow.
Exactly. And people are always surprised to hear that, because you hear, yes, it's exciting to be able to offer that kind of information, because it is life-changing, and people can be like, oh, well, I don't have Borrelia, I'm barking up the wrong tree, but it doesn't mean you don't have one of the co-infections.
Sure. But still, it's good information. So go ahead, talk about some of those co-infections.
Yeah, so let's talk about Babesia first. So Babesia is a malarial type organism. It's intracellular, which means it's inside the cell, and it causes spontaneous sweating. So during the day or at night, to the point of soaking the sheets. And this is different than hot flashes. So you may be able to. You
read my mind.
Yes, exactly. So if you've had hot flashes, this is going to be different. You're not going to feel that slow, steady heat come up, and I know it's different for everybody, but it's more of a spontaneous sweating. You're usually the hottest person in the room. Oftentimes these people are outside shoveling snow in 20 degrees without a jacket on.
Wow.
You'll generally have awful sleep. So a very hard time falling asleep, a very hard time staying asleep. You'll have depression to the point sometimes of suicidal thoughts, and you'll have anxiety to the point of panic attacks. And unfortunately, these are the people who actually commit suicide, who have Lyme and Lyme type co-infections, because the mood stuff is so bad. It's really debilitating. The last thing is that oftentimes people will also have air hunger or a shortness of breath that they can't explain. You walk 5 feet and you're like, why am I short of breath? Now, you don't have to have all of these symptoms, but generally if you have half of them, you have Babesia.
Wow. And this is great, not just for anyone listening, but for our loved ones, right? I mean, we all know someone, honestly, it's a single degree of separation, someone that's just debilitated by a chronic condition. So this could just be helpful for anyone. Wow.
Absolutely. And then Babesia also makes Borrelia 3 times worse.
Okay.
So this is kind of where they start compounding each other.
Feeding each other. Yeah, wow.
Yeah.
And those are 2 types of Lyme, right?
Well, Lyme generally.
Oh no, Babesia is malaria.
Right, but so Lyme came out of so in 1980s, there was a breakout of juvenile rheumatoid arthritis in Lyme, Connecticut. And Dr. Bergdorf, who was the pathologist who went there, did some research and found that it was caused by this spirochete, this bacteria that was shaped like a spiral, called Borrelia burgdorferi. He named it after himself, of course. He gets to do that.
Yeah.
And so that's Borrelia. So when we talk about Lyme, generally we're just talking about Borrelia, but often now with our knowledge around co-infections, sometimes Lyme can include the co-infections. I usually say Lyme and co-infections because people are most familiar with Borrelia, but it is important to discern that. And so people can understand that somebody can just have Babesia and not have Lyme, not have Borrelia.
Right.
But they still
have fatigue.
Right, still have fatigue and still need a Lyme literate doctor or a doctor who's going to be able to address these infections. So can I jump to the next co-infection?
Please, yeah.
So this is one of my favorites, and you can find lectures that I talk
We are
about.
definitely nerds.
That's right. So this one's called Bartonella, and if you type in Bartonella, Dr. Hirsch, you'll find a whole bunch of videos on YouTube where I talk about this specifically. So Bartonella is a bacteria that's found in our domestic animals. So upwards of 50% of all of our cats and dogs actually carry Bartonella. If a cat scratches you and you get cat scratch fever, this is acute Bartonella. So happens when you get very big lymph nodes. But when you get chronic Bartonella, it also comes with a series of other symptoms. So people can have body pain. So a lot of people with fibromyalgia have Bartonella. They'll have neck pain. They'll have back pain. And this is muscular pain. They'll also get headaches or migraines. They'll have a hard time sleeping, but not as bad as babesia. They'll have anxiety and depression, but not as bad as babesia. They will have, this is one of the big symptoms, they'll have pain or discomfort on the bottom of the feet or in the feet.
Oftentimes it's really specific, so
very
that's
specific.
helpful.
Yeah, Bartonella loves the small blood vessels. So oftentimes the hands and the feet are very specific. So it'll be either a burning on the bottom of the feet, or sometimes people say, you know, when I get out of bed in the morning, my feet are really tender and I just want to put on my slippers. So it can be like that. Sometimes there's joint pain in the feet too as well.
Oh, these are really practical symptoms you're mentioning too. I bet that's very helpful.
Right.
Please go on. This is fantastic.
And then there's muscle cramping. So usually in the calves, usually at night. And then these people oftentimes that can get better when you take magnesium or when you drink more water or you take that potassium, but that doesn't mean that you don't have Bartonella as well that's causing it.
And it's 50% of our domestic pets, right?
Yeah, so if you've been licked in the face by your animal, it's very likely that you have it. However, not everybody manifests the symptoms. So this is really important because, you know, 90% of this thing right here, this whole human frame, are bug cells. 10% are human cells, right? So people are always like, what? What are you talking about? Like, we have this beautiful symbiosis with all of these bugs. So it's very important to remember that most of these bugs that I'm talking about are in your body, are there without a problem. But when you get heavy metals, chemicals, and molds, and the immune system gets hijacked over here, these bugs become opportunistic. The immune system is no longer there to keep them in check, and they come out and they start causing problems.
Right.
So you don't need a big inoculation from a tick. You can get it from kissing somebody or sexual contact or a blood transfusion, or you can get it from mom through the placenta. If mom has these same symptoms and you're thinking, oh, that must be genetic, it's very possible that it is from a Bartonella infection that got passed through the uterus that didn't manifest until you got older.
It always comes back to the mother. Disney kills us off. We transfer our microbiome. It always comes back to mom.
Yeah, there's no blame, there's no guilt here. You know, you definitely do not feel bad here. It's just knowledge. I'm saying that to all your viewers.
Good to know. It's good to know, though, right?
But yeah, we dump all of our good stuff and of our bad stuff into our babies. I mean, it's dads too, because dads give mom whatever they've got, and then moms give it to the baby. Right. So it's just kind of the life cycle of the infection, and it doesn't, you know, with that knowledge, then you just know that, okay, this is something that I have to work on. I mean, I know what my kids got because I know what her mom and I have.
Yeah,
you know, so I know how to treat her.
Knowledge is power. Denial never helps. Facing things face forward is always the best way. So interesting. So in clinical practice, here you are, you've got 4 walls, you can help one patient at a time. And I imagine that with this information, it can be a little overwhelming, right? Having this knowledge that you have and wanting to help more people. So I know there's got to be a way that you help lots of people. So how can we learn about this, or what's the first step that someone takes to learn about what kind of fatigue they have?
Absolutely. Yeah. Thanks for asking that. So yeah, I realized that, you know, my mission is to help 1 million people resolve their fatigue. And I realized that I could not do that with one-on-ones. There aren't enough hours in my lifetime.
I know.
And so I created a group program and I created an online course. I basically dumped my brain into the online course and created a 70+ page workbook that I take people through. So we talked about all of those causes, and they're all in checklists. So it's like, do you have these symptoms? Do you have these labs? And I tell you exactly how to get the labs, where to get them, how to interpret them, and then you can fit them in. Do you have them as confirmation? And then you can determine if you have this cause. And like we talked about, it's all about the causes. And I've dumbed it down, so to speak, to try to include no fluff. So this is an outcomes-based program, which is just all about getting results. What is the fastest way to get results? And so a lot of it is me going through the workbook on exactly how to fill it out. And then once you find your causes, then you jump into the second half of the workbook, which is going through, okay, you have this cause, you take this supplement, this month supplement. You have any questions, you ask them in the Facebook group or in the comments of the course, so that people can continue to move, continue to make progress. And it's been great. I've loved to see the progress that people are making in resolving their fatigue.
It's empowering. It's empowering, especially for someone that might not have access to a practitioner. And there's for lots of reasons. Sometimes it's geography, you can't find one in your area. Sometimes it could be financial. It could be, do you really trust some of these people? There's a lot of angst, I think, when it comes to finding the right practitioner. And so someone that spends their waking morning, noon, and night, and I really feel like this is where medicine is going, is every expert in their field can help as many people as possible like this, right? So that every practitioner isn't responsible for knowing how to solve everything. In fact, most doctors don't. It's too much to know, right? And so I think what's really exciting is Dr. Hirsch has a PDF version of his book, Fix Your Fatigue. And he's actually giving everyone, all of our listeners, everyone in our tribe, a free copy of his book. And he also has a Bartonella quiz that we can access to. All of this is in the show notes on evolvingageless.com, and a lot of information about Dr. Hirsch and all of his programs and ways to get in touch with him. Everything is all in one place, nice and easy for you. Is there anything else, Dr. Hirsch, that we should be aware of, or anything that we can do to take action against these things?
Well, I think that's just it. You have to take action. If you have fatigue, you have to find a way to get better, and you have to just get educated. And so, you're going to get the PDF of my book. You can also get it's on Amazon. You can get it on Kindle or paperback. You can jump into the course. Like, you need to get help, and you need to move in a positive direction, and you just have to continue every single day. If you just do one thing to improve your health, one thing to get more knowledge, you're going to get there. And I also want to dovetail on what you said about practitioners. Like, functional medicine practitioners are great, naturopaths are great. There's a lot of conventional MDs that are doing really great work out there, but you have to realize what they're missing, because even functional docs and naturopathic docs are not addressing all of these causes. So when you go to see somebody, you want to ask, how do you address mold? What is your knowledge around mold? What's your training around mold? How do you address Lyme? What's your knowledge around it? And I do all this stuff naturally. I don't do it with any medications, even though I'm an MD. And so you also want to ask them that question too, because most of the research is on using natural therapies for a lot of these infections versus IVs versus antibiotics. As soon as you remove them, the symptoms come back. So
yes, I know so many practitioners that will play support, and people are on antibiotics, and we know the challenge with long-term antibiotic use. So it's just huge. Such great advice. This is wonderful. Thank you so much.
You're so welcome. Thanks for having me on and helping me with my mission.
Absolutely. Well, thank you for helping me with mine. We're changing the way women age. So here we go. All right. Well, everyone, thank you so much. Check out evolvingageless.com, the show notes, everything you'll want to know about Dr. Hirsch, his program, his practice. Get the book. Help a friend. Help a loved one. Help us with the missions that we're on. Have a wonderful day and live ageless.